So in terms of the learning objectives, the purpose is to help you guys understand about what are the medication options for ADHD. Also, we'll talk a bit about how other conditions might influence ADHD treatment and what decisions you might make. But really, most importantly, I hope you leave this feeling empowered as parents to be active participants in the decision making around your child's ADHD treatment. I don't have any financial disclosures or relationships with any pharmaceutical companies. I will be using some brand names for clarity, and I will mention one off-label medication. And so I'll try to remember when I get there to mention which one, but everything else is on label and approved for ADHD. So first step, I think when we talk about medications is just take a deep breath and relax. Really find your zone of tranquility. It's easy to get emotional when it comes to our kids, and ADHD kids are unique. So it's no surprise that each of your journeys in terms of treating your child's ADHD is unique, and there's really no right or wrong decision with regards to treat these treatment decisions. So you know your child best, and you're a powerful advocate for them. So this is really to empower you with information, not to try to influence you in a decision one way or the other. So I'm going to talk about one study, and the reason I'm going to start with this was a very influential study. It's now about 25 years ago, and it really underpins how we understand ADHD treatment today. So it's a very high quality study. They had about 600 kids and divided them into 4 different groups. So a quarter of them, the blue box, got just medication treatment for their ADHD. Another quarter, the orange box, got just behavior treatment, so intensive behavior treatment. The green box, the lucky green box, got both. So they got both medication and behavior treatment. And then the purple box got community care, which was really just kind of regular things going to see the doctor. It wasn't any particular added on thing. And one of the main results that came out of this was that the kids who got medication had the biggest improvements in ADHD symptoms. So in terms of their ability to focus, sit still, help with their impulsivity, medication was the biggest result. And in fact, when they looked at that combination group that got medication plus behavior treatment, it wasn't any better in terms of those core ADHD symptoms. But there were also some really other important results that came out of this. So when they looked at that combination group, there were actually some other really important benefits. So adding on that behavior treatment, kids were less oppositional, they had improvement in their social skills, and there was improvement in the parent-child relationship. So lots of added benefit, but not so much in terms of like helping a kid actually sit still and focus. The other important thing to note that came out of this was that the kids in the combination group actually needed lower medication doses to get the same benefit. So it had some pretty substantial impact, this study. So if we go into medication treatment, I think the first thing to think about is when might you consider medication for ADHD? First of all, you really want symptoms that are significantly interfering with a child's functioning. So at school, at home, or with socially. You want to have a good evaluation. Is there anything else that could be contributing to the child's difficulties? Do they have anxiety? Is there something, history of trauma that might be, masquerading as ADHD? So you want to make sure you have a really good assessment. You want to have a good physical exam. Make sure that your child's heart is healthy, because we know medications for ADHD can have effect on the heart. For teens, we also want to assess substance use because there can be interactions between ADHD medications and recreational substances. And most importantly, sort of bottom line is everyone should be well educated and prepared for the trial of medication. It's rarely an emergency to start ADHD medication, so there's plenty of time to think about it and do your research. We're lucky enough in Canada to have an excellent group called CADRA, which is made up of professionals from a number of different disciplines that are brought together to have guidelines and recommendations about ADHD treatment. And they keep these quite updated. The last one came out just a year ago. And if there are any parent physicians in the audience, you probably recognize this little medication chart. It's a one pager. It's really helpful. It lists all of the medications that are approved for ADHD medication in Canada. And even for, I think for parents, it's really helpful. It has pictures of what the pills look like. It says, can you sprinkle them? Do you have to swallow them whole? So it's just a really nice summary of all the medications. The ones that are marked in green are the first line medications, and the ones in blue are second line. So first line means what we like to try first, and second line is what we try second. Um, and all of those first line medications are long acting stimulants. The second line medicines are short and intermediate acting stimulants, and then there's two non-stimulants that are approved in Canada. One is atomoxetine or Strattera, and the other one is guanfacine or Intuniv. And I've got the link there to that where you can find that chart if you're interested. So first question is like, why are stimulants first line? So as I mentioned, the research, really shows that medications are the most effective treatment for those core ADHD symptoms, and stimulants are the most effective medications for ADHD. So they're very effective medications. Over 90% of kids who use them will have symptom improvement with stimulant treatment. Another thing that's very nice about stimulants is they work quickly. So they're not like medications, some of you may be familiar with medications for anxiety or depression or some other types of medicines that you have to build up gradually. It takes a while to see the effect and then you have to stop gradually. These are medicines that you can tell often within a week, sometimes within a few days, what kind of effect they're having. They can be started easily, they can be stopped easily. So they're quite easy medications to use in that sense. So how do they work? I tend to think of stimulants as a really strong cup of coffee. So they're working on alerting and focusing your brain. In terms of neurotransmitters, they're working on that adrenaline system, the dopamine system. So they're your alerting action neurotransmitters in your brain. And it's very effective, as I mentioned, for improving ADHD symptoms. So concentration, attention, organization, they decrease impulsivity, they decrease hyperactivity. And that's all well and good, but what we're really looking for are some of those secondary effects. So when kids are able to concentrate better, that increases their productivity at school. There's fewer careless errors. In most kids, they decrease aggression and defiance. When kids are more regulated and not as impulsive, they that can help with their social skills and help with those peer acceptance, and that has big downstream effects on self-esteem. There's also a number of studies in adults looking at things like accident rates, driving performance, and lots of good evidence that the stimulants really help in many of these realms. So this is just a little cheat sheet to try to help you. There's lots of different stimulants, and so this is to sort of try to help you organize them in your mind. There's two main families of stimulants. They both are working in very similar fashions, but one is the methylphenidate family and one is the amphetamine family. So these are working on these alerting, activating parts of your brain. Both families have short-acting forms and long-acting forms. And so the short-acting ones are the ones that have been around for a long time. So Ritalin is the short-acting form of methylphenidate. And so many of you would have heard that. That was, I think, the very first stimulant that was available years ago. And then in the amphetamine family, the short-acting form is dexedrine. In recent years, there have been lots of advances in ADHD medication, but all the advances, they're still part of these two families. So the advances have not been really new medications, but they're new formulations that allow the medication to last longer in the body. So when kids used to have to take Ritalin for ADHD 35 years ago, they were having to take it, often three, sometimes four times a day because it had a very short life in the body. Whereas something like Concerta, you can just take one time in the morning and then it gradually fades out of your body during the day. And so that's really the advances that have been made. So in the methylphenidate family, we have Concerta, we have Bifentin, we have Foquest, and we now have Quilivant, which is our newest one. And in the amphetamine family, the longer acting forms are Adderall and Vyvanse. There are also are some intermediate acting forms, which I've just sort of left out of this diagram for clarity. And when you think like, why might you choose one or the other? What are the differences between the two families? They're really more similar than different, to tell you the truth. But the methylphenidate family tends to be slightly milder. So when we measure effect sizes, which is how effective a medication is. So the methylphenidate family has a moderate to strong effect size, which is 0.8. Whereas the amphetamine family has a very high effect size of 1. So the amphetamine family is a bit more effective, but that also means that the amphetamine family has slightly more side effects, and the methylphenidate family tends to have milder side effects. And for that reason, we often will start with the methylphenidate family, especially with younger kids. And if those don't work, then we'll usually try the amphetamine family second. The one exception is that Vyvanse is in the amphetamine family is really quite a good medication for teens. And so sometimes for teens, we'll actually start with Vyvanse. So when we think about stimulant side effects, our strong cup of coffee analogy still really works. So if you drink coffee too late in the day, you're going to have a hard time sleeping that night. If you drink too much coffee, that can sometimes give you a stomach ache. If you drink too much coffee, it can sometimes make you feel a little bit irritable or on edge or anxious. And so those are the side effects that we do see with stimulants. It's almost a misnomer to call them side effects because these are direct effects of the medication. So that same part of the brain that's alerting us and getting us ready for action, it means we're not sending, blood flow to the gut for digestion. That's relaxation. So that's why kids have less appetite when they're on stimulants. It's like they're in an alert mode. And that's also why for some kids, we will see more irritability or anxiety because we're kind of ramping up that fight or flight. And so some kids are sensitive to that, and that's where we sometimes see kids that have difficulty tolerating the stimulants. We do sometimes get stomach aches, headaches, not usually a big problem. Sometimes for kids with tics, we can see worsening of tics, but again, that's not usually it's not usually, don't have to usually discontinue the medication for that. There are some long-term effects to be aware of. So if kids' appetite is down and they're not eating as much, that can have effects on growth. And so when kids are on stimulants, we always want to make sure we're monitoring their growth over time. And same thing, so stimulants are not just alerting your brain, they're alerting the rest of your body, and that has an effect on your heart. So that can increase your heart rate a little bit, increase your blood pressure. And so those are also things that we monitor. And that you monitor long term. That's not just an immediate thing. That's something that you keep monitoring if you're on stimulant medication. So really, when you think about stimulants, the goal is to find the sweet spot. So we want to get enough of the medication so that we're getting those benefits, but not so much that we're getting into problems with the side effects. And often that means we're not aiming for perfection in every ADHD symptom. We're just trying to get enough dampening down of those ADHD symptoms so kids are able to function better, but not so much that side effects are a problem. There is an excellent handout on the Kelty website called Managing Stimulant Medication in Children and Adolescents. And it's really got tips and tricks on how to manage these very predictable problems. So, for example, very predictably, kids who take stimulants aren't that hungry at lunch because that's when the stimulant's highest in their body. So the strategies to help with that are, having a big breakfast, having smaller meals during the day, so sort of grazing. Some kids will have like a second supper before bed, hopefully a healthy second supper, because by that time the stimulant medication's out of their body and they're hungry again. If your child's having problems sleeping on stimulants, you can try to give the medication earlier so that it wears out of their system earlier before they start getting ready for bed. Um, Sometimes you can also switch to a shorter acting medication. It's one of the nice things of having all those different options of stimulants is some last a bit longer, some last a bit shorter. For kids who experience irritability or low mood, um, it's important to differentiate, is that all the time on the stimulant? Some kids, we do see that a little bit when they're wearing off, and that's a sort of different strategy. But if a child's having irritability or more anger outbursts, more meltdowns on stimulants, the first step would be to try to lower the dose. If that predictably happens, like say two stimulants and on both different stimulants they have this, for me, that's a reason to switch to a non-stimulant. It's sort of saying right now that that child just that extra bump of adrenaline is just not where they're at right now. So that's a reason to switch off stimulants. Um, and last one to think about is sometimes that stimulants work great, but they wear off too quickly. And that's when we might think of switching to a longer acting form, maybe giving a pill later, or sometimes we'll add a non-stimulant, which provides more 24-hour coverage. So that's actually a good segue to non-stimulant. So when do we switch off the stimulants? So the first scenario is when stimulants from both medication families haven't worked. And as I mentioned, that's actually relatively rare because we can, 90% of kids will see symptom improvement with stimulants. The more common scenario for switching is yes, the stimulants work, but the side effects are just not worth it. Whether that's irritability or maybe the kid's appetite's really affected. And so that's actually a scenario that's the more common scenario for switching to non-stimulants. And sometimes there's other factors like sleep or anxiety that might make us think of a non-stimulant first. So I'll tell you a little bit about the non-stimulants. Um, so there's two that are approved, and one is guanfacine or Intuniv, and the other one that's approved is atomoxetine or Strattera. Clonidine, this is the one flag, is the one that's off-label. So it's very similar to guanfacine. It's a much older medication, much less expensive, but it hasn't officially been approved for by Health Canada, and it probably never will because there's no drug company that's putting forward an application because it's an old, inexpensive medication. These medicines are different from stimulants. So stimulants, I mentioned, you can stop, you can start. Non-stimulants, you have to take every day. The dose goes up gradually when you're starting, and it has to go down gradually when you're stopping. And so it takes more patience to see the full therapeutic effect. It can take 4 to 6 weeks. Um, and they're less of a wow. No one, sometimes with stimulants, kids will say like, "Oh my gosh, my brain feels different. I can actually focus." This is less of a wow, but they can be better tolerated and they can actually help with other things. Um, and they don't have any abuse potential, which sometimes if a teen has substance use issues, that's also a rationale why we might use a non-stimulant. In terms of comparison, so atomoxetine or Strattera has been around for quite a bit longer, and we used to use it more. I think most of us would say it's probably not so effective for ADHD, but it is somewhat effective for ADHD. And its niche is that it also can help with anxiety. So if you have a kid with sort of milder ADHD and mild anxiety, atomoxetine might be a good medication to try. Um, I would say since guanfacine came out, this is the non-stimulant that we probably use more. So guanfacine and then clonidine, which is the older medication in the same family. And the reason that these medications get used more often is they have some other side benefits which are really helpful. So they can help with sleep, they can help with emotional regulation, and they can also help with tics. And we know these are some of the things that often can go along with ADHD. So that's really helpful. The other thing that's nice about the guanfacine medication is that it's approved for monotherapy, which means using it by itself, but you can also use it with stimulants. So if a child's having some benefit from stimulants, but maybe can't tolerate a very high dose, or maybe they're having more problems in the evening when we don't want to be giving them stimulants, you can combine a relatively lower dose of stimulant and then adding with the Intuniv, and then you can and have quite a good result. I wanted to mention drug holidays because this is a question that sometimes comes up. So a drug holiday is time off medication. So it could be on the weekend, it could be over winter break, over the summer. It's very easy to do with stimulants. It has some nice advantages. It can allow for catch-up eating and growth if a child's having difficulty maintaining their appetite. So sometimes you'll see kids who take their stimulant medication on school days and then they don't take it on the weekends, and they tend to eat more on the weekends. Um, Importantly, it can also allow for reassessment of baseline. So is this medicine still needed? Sometimes a medicine's been started for a long time and you just don't know what its impact is anymore. It does have some downsides. So if a medication's really helpful and we take that away, that can have a negative impact on the child's functioning at home and extracurricular activities, like if they're doing a summer camp. But even then, you can sometimes try to do it like maybe in between those, just to see what the baseline is. It's harder to do with non-stimulants because you do have to go down gradually on the dose, but it's possible to try it over the summer when there's enough time. So something to think about. In terms of cost, Pharmacare is the government-funded program that covers medications, and Pharmacare has some real constraints when it comes to ADHD medications. So Pharmacare requires that you first try a short or intermediate acting stimulant to be able to be eligible for a long acting. So that means trying something like Ritalin or Dexedrine Spansiol. So you have to try those first. Afterwards, if you try that and it doesn't work, then it will cover Concerta, Fulquest, Adderall, Vyvanse, and the one non-stimulant it covers is Strattera. So that's helpful. But there are some really useful ADHD medicines that are unfortunately not covered by Pharmacare. Bifentin is a medicine that we use a lot, partly because it can be sprinkled, and so that's really helpful for kids who can't swallow pills. And Intuniv, that medicine, guanfacine that I mentioned, that really is very helpful, is not covered. And this is where clonidine can be very helpful. So if you don't have an extended health plan that covers Intuniv, then clonidine is a good replacement for it for Intuniv. Um, so just going to touch briefly on what to do if there's more than one thing going on. So ADHD plus something else. And in medicine, we call that comorbidity. So when you've got more than one condition going on, and it's really common. Over half of the kids with ADHD have at least one other condition, and many children will have two or more. Probably most common is anxiety, certainly sometimes learning challenges, oppositional defiant disorder, sometimes coordination problems. In teens, certainly ADHD we know puts teens at risk for substance use disorder, so we can see substance use disorder in teens. So I'm just going to talk, not going over every disorder, but just a little bit of some of the common ones about how we might manage ADHD when there's more than one thing going on. So super common is a child with ADHD plus anxiety. And in that case, the first thing that we like to do is really add counseling. So cognitive behavioral therapy, or CBT, is really first line for anxiety, and it can help both with anxiety management, but also help decrease the impact of ADHD on self-esteem. So that's a really helpful thing to think about adding for anxiety. When we're looking at medication, there's always this question, if both are present, well, which do we treat first? What do we start with? And if the anxiety is mild to moderate, I would often recommend trying to treat ADHD first. Because in many children, improving the ADHD symptoms can help decrease anxiety. Their lives become less stressful, less chaotic, and that can really help with anxiety. So sometimes just treating the ADHD is sort of enough for the anxiety. Um, if, on the other hand, the child has really more amped up, more severe anxiety, then I might recommend starting an SSRI, so one of the anxiety medications first, before a stimulant medication. And the reason for that is I mentioned stimulant medications, they're kind of alerting you, but they're actually working on that adrenaline fight or flight system. And so if you've got a child who's already quite anxious and worked up, that can make the anxiety worse. So in that case, what we do is we tend to say, let's try to get the anxiety better under control, and then later start looking at what we're going to do with the ADHD. Um, Autism is another increasingly common comorbidity with ADHD. Stimulant medications are still first line, but we know kids with neuroatypical brains are just a little bit more sensitive to medication. So we'd watch for those activating side effects, the irritability or anxiety. And so we do end up using a lot of that guanfacine XR and clonidine. They're good alternatives to stimulants because of their benefit for emotional regulation. And of course, I mean, really for all kids, but I think for kids with neurodevelopmental disorders, ensuring that appropriate supports are in place at school and at home. Last thing to think about with autism and other neurodevelopmental disorders is just considering anxiety. It can sometimes present differently in kids in with neurodevelopmental disorders, and so just having your radar out for that. ODD. So this comes up a lot. So ODD is oppositional defiant disorder, and I have a bit of a philosophical issue with it. In my mind, it describes challenging behaviors, but it doesn't say anything about what's contributing to the behavior. You know, is the child anxious? Is this just sort of the impulsivity of ADHD that's making their behavior so challenging? And I really do feel that kids want to be successful, and these difficult behaviors are usually the result of poor coping skills, which overwhelm the child's ability to deal with a stressor. So treating the ADHD with stimulants generally helps oppositional behaviors as kids have a bit more of a filter, they have a bit more time to think before they react, so that's helpful. But in these cases, you know, going back to that original study I mentioned to you, parenting and family interventions are particularly important. So we really do see a lot of added benefit in those oppositional behaviors with all the other good things that you're going to be hearing about today. So in conclusion, for best outcomes for ADHD, we really want to consider both medication and non-medication treatment. Doesn't mean you have to use both, but think about them. They both have advantages. Stimulant medications are first line in almost all cases. Really importantly, ADHD medications can protect against negative outcomes of ADHD. Comorbidities, so those other disorders are common and they can affect the choice of treatment. And sort of, I think my main message to you is the more you and your child become experts in ADHD, the better you're able to direct your treatment and just sort of feel in charge. And so that's sort of my plug to you to learn a bit about the medications.